Okay, welcome everybody to our Media and Health Symposium here at Virginia Commonwealth University. We're very excited that you are able to join us today. We think we have a great program. My name is Medina-Messner. I'm the Executive Director of the Center for Media and Health. And with me is Dr. Cheng, the Director of the Robertson School for Media and Culture here at VCU. Thanks for being with us, Hong.
Yep. Thank you for having me here. Great, Dr. Messner.
So let me say a few things about our symposium. This is the third time we're doing this annual symposium. This is the second time we're also doing it as a virtual symposium. So you can join us in person here at VCU. We are in the Academic Learning Commons in the Art Lab on the 4th floor. That's the new building right next to the library. But you can, of course, also join us online. We're going to run all sessions today on Google Hangouts, and you'll be able to watch those Hangouts and also interact with us on Twitter. And my colleague Scott Sherman is going to talk about that in just a few minutes. We have a professional panel, we have a teaching panel, and we also ran a peer review research competition, and so we also have research panels. The papers and summaries of the research that you will hear about today, you can download them on our symposium website, and it's password protected, so all of our authors can later publish their papers, and it's a very easy password. It's VCU Global Health, and that's also our hashtag today. So with that all said, maybe a few words from Dr. Cheng.
Yep. Thank you, Dr. Messner. Good morning, everyone. Welcome to the third Media and Health Symposium hosted by the Center for Media and Health in the Richard T. Robertson School of Media and Culture at the Virginia Commonwealth University. And people tend to say the third is the charm. Okay. So we are doing this symposium for the third time. So everyone could expect something charming today in this symposium. Okay. And as Dr. Messner mentioned just now, okay, this symposium is clearly focused on mobile and social media and public health, which, as we all know, are two very, very important areas in social and human life. No matter you are a professor or a media and health professional, or you are a graduate student, I'm sure you will find something interesting and refreshing in today's symposium. Okay. And as also Dr. Messner mentioned just now, this year's symposium is different in some way from the previous two, okay, because all the papers accepted by this symposium went through a rigorous peer review process. We tracked papers from many parts of the country. Okay? So a lot of things to expect and from this symposium. For this symposium, of course, it's impossible with hard work and valuable contributions from many individuals. Okay? First of all, I would like to thank Dr. Messner for his excellent leadership for the symposium, as well as the Center for Media and Health as the executive director of the center. And his team, everyone, graduate students, colleagues, okay, staff members, they contributed so much to make today's symposium possible. I also would like to take this opportunity to thank our colleagues in other academic units at VCU, and also the colleagues in the sibling universities across the country. I know you cannot wait to see this symposium fully unfolded. Okay? I hope you are enjoying it, and I wish you a great day. Thank you.
Great, thank you so much, Hong. I'd also like to thank the Robertson School and Dr. Cheng for supporting this symposium, also the College of Humanities and Sciences and Dean Baskey, who've been great supporters of our center. And then, of course, there's a great team behind the scenes today, and you will be seeing them probably running through the picture from time to time. So there are many hands that make that possible today. With all that said, I'm going to hand it over for a few minutes to my colleague Scott Sherman, who is in our audience room, and he will talk a little bit about the program that we have today and how you can engage with us online. And while we hand it over to Scott, we're getting ready for our first panel here, which will be a teaching panel on an open online class on global health and social media. And then after that panel, at 10:15, we will have our first research panel, then leading into a professional panel. And we're also serving lunch here today. If you're in Richmond at VCU, please come and join us. And maybe one more word of thanks is to the Alt Lab. That is the cool room that we can be here in today. And they've been great supporters of us as well. So thank you so much to Jonathan Becker and his great team at the Alt Lab. And with that, I'm handing it over to Scott.
Thank you, Marcus. And thank you, Hong, for the charming introduction. Today, we've got a lot of programs going on. I'll go over the program just briefly. At 9:30, we started with the welcome, which you just had. 10:45, also we have a teaching panel that's about to start in a few minutes. And at 10:15, we've got a research panel that focuses on visual strategies in health communications. And at 11:45, we have our professional panel with a representative from Franklin Street, which is a healthcare marketing and branding firm. And they're going to be talking about the healthcare marketing trends for 2016. And then we'll have lunch at 12:45. So if you're at VCU, come on to the address is 1000 Floyd Avenue, 4th floor, and you can join us. It's from Joe's Inn. 1:45 is a research panel, and it's going to be focusing on mobile technology in health communication. And 3:15 is the last research panel of the day, and that's focusing on uses of social media in health communication. And we should be wrapping up at about 4:15 today. And I think that's about it for the overview. We're broadcasting from the audience room. We're a couple of doors down the hall from the broadcast room. So you'll see some of us. If you want to ask questions, just do it online at the hashtag VCU Global Health. We hope to hear from you. I'll shoot it back to the studio.
Great, thank you so much, Scott. And we're ready here for our first panel, which is a teaching panel. And we're very excited about this panel because it's actually the end of a competition. And we have two students with us, Danielle Ferguson and Hannah Bass. They're advertising and public relations majors in the Robertson School. And then we also have Vivian Medina-Messner, a journalism professor in the school, and Jeanine Guidry, a doctoral student from our medical campus, but is also working very closely with the Center for Media and Health. And so they will present on an open online class experiment that we're having here at VCU. We've taught this class for 2 times, and it's completely online. I've met Danielle before. I think Hannah, we've seen each other for the first time today. So we all taught this class together in the fall, and Danielle and Hannah were students in the class. And it's completely online, and we're doing service learning social media campaign projects in that class. And Danielle and Hannah and their teams, they won the competition among many teams and were picked by their clients for the best project. So congratulations again. Yeah. And so the trophy, the winning prize is of course an A, but it's also that they can present their work here at the symposium. And so Vivian and Jeanine, they're going to guide us through this panel, and I'm going to just pull up their PowerPoint right quick, and then we're all good to go.
Great, everyone. Well, thank you so much again for being here. This is Vivian, and as Marcus mentioned, this is an open online course. It's a special topics course. This is a special online topics course that was also designated a service learning course. And what that means is that, of course, that we work with the community and we provide a service. Now, this course was taught in fall semesters of 2014 and, of course, in the fall of 2015. It was also developed with the Out Lab here at VCU. So it enrolled over 100 students. So we work with the students here, but also it was different in the sense that we, for the first time, offered this course through the VCU office for continuing and professional education. It was a pilot class because we invited people from the community. We had 15 public participants who enrolled for certificate, again, through the Office of Continuing and Professional Education. Now, the way this class works is that we have online lectures. We pre-record these lectures on a weekly basis, and we showcase some of the cases. And of course, we talk about health issues and health-related information, but also the impact of social media. So what was great about this course is that we also had a chance to bring in experts from different organizations such as FEMA, the American Diabetes Association, Charity Water, Doctors Without Borders. So here you can see we had a live Google Hangout, and we were walked and we talked with professionals. They talked about how it is to experience a day in their lives. So it was very interesting for us and for our students to actually talk to social media experts, and they talked about the strategies, how they go about on a daily basis to work with the people in the community to grow their grassroots efforts. So it was great talking to these social media experts. So here, we'll also talk about the different interactive components. We have the online discussions and reflections, which Jeanine will talk about. Jeanine, can you walk us a little bit through that experience?
So we had a discussion board that was part of the online platform where students every week would participate in online discussions, sort of in lieu of in-class discussions. A discussion topic would get started by us, by the course staff. It would be anything from post a nonprofit organization that you think does a really good job in their Facebook engagement, post a health nonprofit that has struggles in the area of dealing with, for example, Instagram. So it all was related to health organizations, both non and for-profits, and at the same time it was focused on the platform, so Facebook, Twitter, Instagram, and Pinterest. So the students were required to post an original post every week, and also then post 2 replies to their classmates. So we had really a lot of interactivity built in that you would normally find in a classroom, but done online by having these discussions happen organically within the framework of the discussion platform.
Great, and what's great about these online discussions is that students work in smaller groups, right?
Yes, and that's the whole thing was a lot of times students were starting to work in small groups, especially towards the end of the program where we got practical. Another main component of our program was having the students actually being engaged on Twitter and Instagram. So, and I don't know if this is visible, but if it's not, I will describe it for you. Students were required from the 3rd week of the course on to tweet 5 times a week. On every weekday, they were supposed to tweet using hashtag VCU Global Health. So that's a way that we could keep up with the tweets and aggregate them. And the students would pick health-focused topics. So anything from advice on hand washing. I remember a tweet coming through on that, to anything about the Google Hangouts of that week. And so what we had on our website is you could actually see how all these tweets were interacting with each other, who was responding to who, where the tweets would originate. And there was a lot of activity. I think I just ran a test last week. We had more than 4,500 tweets that were tweeted with hashtag VCU Global Health by our students and a little bit by the course staff during the course of the class. The other platform, Instagram, which of course is a very different platform, and one of the reasons we included it is that our health communication, our communication in general, is becoming more and more visual. See that at platforms like Instagram, Pinterest, Snapchat. And so we required the students from week 4 on to post something on Instagram, health-related, twice a week. And so it's a little bit more involved because they actually had to come up with a photo and a caption. We had 1,000 of these posts that by the end of the course were populated the VCU Global Health hashtag. And students in the first 4 or 5 weeks of posting on Instagram would post things that they would find online that are related to health, issues that were related to hunger, to ongoing and past epidemics like Ebola, to things like heart disease and diabetes, and ways to interact around that online. When we got to the last part of and you'll see a whole lot more of this in a minute, of our course, which was where students actually started working with clients, with nonprofit clients, a lot of the Instagram posts were starting to show up from those clients, basically with material photos from the clients and the students then developing campaigns. And so this was, in the first place, to really teach everyone how to interact on global health and social media. Because it's one thing to run a personal Instagram account or Twitter account. It's another thing to actually communicate things about prevention, about health communication, and to actually do that in either 140 characters or in one photo and a very short caption.
Thank you. Now, another way that we manage communication, because as you can imagine, it's challenging to manage so many students, but also different. When you're organizing different groups and you're organizing small projects, one of the ways that we organize and manage the communication is through our Facebook group. We have a private group, and here we invite our students and we invite our outside participants, and that's where we launch information about the course content, because we also have a website. So here in our private Facebook group, students can post whatever questions relate to their assignments or whatever questions they have. So that's also an important component of the way we manage the communication internally. All right, so now we're gonna give platform to our students, and you will talk about the student team projects and how you work with our clients.
Okay, so hi everybody, it's Danielle Ferguson. My client was the International Children's Heart Foundation. They are an organization. Their mission is to provide free heart surgery to children all over the world suffering from congenital heart defects. They also, while they're in the country, in the developing world, they train surgeons and the medical staff in those areas to then provide surgeries in the future. And also, they take technology with them to really improve the quality of care for patients. They're currently focused in Latin America, but they've traveled to about 32 countries and counting. So saving hearts all over the world. For our project, our goals were really to streamline their platforms, and they are currently active mostly on Facebook, Instagram, and Twitter. And we really, while we want to develop other platforms for them, sometimes that isn't always the right choice for a nonprofit. A lot of the time they have one person who does 5 other things, and social media is just one job. So we really wanted to just take the platforms that they do have and make them work in the best way possible. So we wanted to do that by starting with Show Your Scar. And that was really our campaign that we came up with, that one of the biggest things that's left behind from open heart surgery is a scar. And everybody has a scar of some sort, and everybody has a story linked to that scar, whether it's falling off your bike or major open heart surgery. And we really just wanted to start a conversation about scars and what they mean and what is the future and what comes next. And we also wanted to incorporate a fundraising strategy as a second prong to this plan, because that was another big goal, was raising money to be able to fund all these fantastic trips all over the world and provide free heart surgery. So that was another thing that we did with a staggered platform of, depending on how much you donated, you got something back. You know, you kind of have to give a little bit back sometimes in order to receive. So ultimately, how we wanted to do this, how we wanted to streamline their platforms, was really to introduce tools that we learned about through the course at VCU. And repost for Instagram was a big one, where it lets you share Instagram pictures from other users, because sometimes sharing content is the best way to generate your own content, especially if you have a volunteer who's sharing great pictures. Flipagram is another one. It allows you to make short, quick videos, and you can tailor them. They can go to Facebook. You can tell the app that it needs to be for Instagram, and it will make your video the correct size for Instagram. Also, Canva is another big one. We did all of our graphics for the entire campaign through Canva, and it's free for nonprofits. They have a paid version, which is free if you submit your paperwork for the nonprofit. And it lets you design things, and it's mostly free. It also has paid options, as well as Hootsuite. Hootsuite is another big one, especially since they just introduced tracking for Instagram. So using that to measure your success and to follow along and see how are we doing, what can we do better, when are posts posting, when are they successful, and it also allows you to schedule. So if they're on a trip and it's 5 o'clock in the morning where they are, they can schedule a post to post at 6 o'clock in the morning Eastern Standard Time. So that's a really great thing for teams when they're traveling. And finally, we also, as another part of the component for the course, we had to campaign for the client. And for that, we really wanted to latch on to the things that they were already doing. And the big one for us was Giving Tuesday, which is December 1st this year, or was December 1st this past year. And it's a response to Thanksgiving. You've been thankful, now give thanks back. So we really tried to latch on to that and post all about it and help their cause, which they raised almost half the money they needed in one day for their trip in January. So that's pretty much what we did for our campaign, and we were really pleased with how it turned out, and we're glad that the International Children's Heart Foundation enjoyed it as well.
All right. Hi, my name is Hannah Bass. My team and I campaigned for Physicians for Peace. And the whole time it was really cool to hear about yours because, I went through the same thing.
Yeah.
So Physicians for Peace is our client, and they're a nonprofit health organization based in Norfolk. They have 2 locations in the Philippines and the Dominican Republic. So what they seek to do is educate communities. So they go into communities and educate the community and health professionals on how to actually fix infections and do nurse techniques and teach them how to do things that doctors would be able to do. So what this does is creates a more lasting solution instead of just going in, putting some Band-Aids on problems and then leaving. So it's really cool that they want to educate people first. And Physicians for Peace really wants to see a world where even though there's going to be problems and disabilities and infections, they want to see a world where people know how to fix that or can start to fix that. So it's already cool to be able to start this campaign, Loving the Organization. So for our campaign, it was a long process. We didn't quite know what we wanted to do at first, but we know we wanted to do something that surrounded the idea of education and teaching, because that's what Physicians for Peace is all about. So we wanted to do a campaign that could interact with all ages, demographics, genders. So we decided to do the campaign Teach for Peace. So what that means is you would say, what do I want to teach? Do I want to teach yoga or laughter or rock climbing or anything that you love to do? And then post that on your personal social media profile or platform with the hashtag Teach for Peace. We also wanted to do a fundraising component as well. So you would also hashtag donate for peace if you wanted to go one step further. So for a lot of people, you know, they like the social credibility aspect of this because it's on their personal profile. But we wanted to focus on the lightheartedness of this campaign, and because Physicians for Peace is such a, you know, it's a heavy topic and World Health is so important, that we wanted to lighten it up and make it fun for people to engage. So we wanted to think of lots of ways for our client to be able to go one step further in their social media. And so like Danielle was saying earlier with Hootsuite and Canva, those are all great social media tools to use. We as well wanted to use Hootsuite and Sprout Social, which is a similar thing to Hootsuite where it monitors all your social media. We thought of the idea to do a sponsored story for Snapchat. So Snapchat, when big events are going on, such as football games or the Super Bowl, they'll have a live story. So if Physicians for Peace could get on that, they could go into showing what they do day to day so people could get an idea and really connect with that. We also just wanted to really encourage anyone looking to do a campaign in Physicians for Peace to just have fun with it. You can't take yourself too seriously on social media, but people really do look at it. So just don't take yourself too seriously, but use it as a great tool. So we also wanted to do, at the end of our campaign, we did a compilation video. So we took all the pictures of everyone posting, I want to teach joy, I want to teach this sport, and we put it together so that people could see, you know, what the whole campaign was from beginning to end. And that just really shows people that a lot of people were engaged. So Physicians for Peace, you know, could do that at the beginning of their campaign or at the end to kind of kickstart it or wrap it up. So other people looking to do social media campaigns could do that as well. Yeah, so I just wanted to touch on again that, you know, our campaign was about teaching, and it seems so simple and such an easy thing, just hashtag Teach for Peace, but hashtags are vital. And in social media, that's what connects everyone. It all goes into the same database, and people, it just really connects people and shows you what you're doing. So yeah, thanks for listening, and we were really excited to be able to do this campaign.
And if I can add something, the clients, I mean, I think one of the powerful things of this whole project was that you actually worked with clients, and that these clients were excited about your project, and both of them actually said, we're going to use parts of this. This is an inspiration for us. This is fresh content, it's fresh inspiration, and we're going to use that. And so your projects are going to be ending up influencing people long after the course is over.
That's the hope.
Okay, so now do we have any questions from the Twitter sphere?
No, we have any questions. You can ask any questions, and let me walk a little bit into the picture. You can ask any questions that you have for panelists throughout the day at the symposium. Just post on Twitter, use the hashtag VCU Global Health. That was actually the hashtag for the class as well. So any questions you have, you want to discuss with panelists today, please join us on Twitter. Well, thank you so much to everybody for presenting, and for you guys to probably do your first presentation at an academic conference. So you did great. Thank you so much, and thanks for all your hard work in the class as well. And thanks to both of you for being such great colleagues with the class. So how this is going to work today is we are going to close each Google Hangout after each session, and then we'll take about a 15-minute break, and you can just see the next Hangout coming up on our symposium website. So our next panel is going to be a research panel with 4 research papers that all went through a peer review late last year. And that panel is going to focus on visual communication, or visual strategies in health communication. So we're going to hear about things like YouTube, Instagram, and things like that. And we have a great lineup of scholars to talk to you in just a few minutes. So that next panel is going to start at 10:15. Please continue the discussion on Twitter, and we will be back with the symposium in just a few minutes. So thanks again to all of you for coming and sharing all your insights on this class. So thank you.